Today, UP Health System nurses are back at the negotiating table in Marquette with hospital owners Duke LifePoint. It's the latest effort for the new parties to come to an agreement over wages and working conditions since negotiations started over 5 months ago. On Monday, the Michigan Nurses Association Union holding a practice strike, and yesterday in the studio I had the opportunity to catch up with one UPHS nurse who told us that one of her top priorities is appropriate staffing.
I really thought that it was going to get better, but I think a lot of healthcare systems saw what we could do then and then have just kind of consistently had us do more with less ever since then. So the number of patients that I would have seen like before COVID has just kind of increased, and we want the safe number of patients for each nurse and each department.
Negotiations happening today, and they will continue tomorrow, with nurses planning to seek permission to strike early next week. If approved by the union, the nurses would still have to give the hospital a 10-day notice before they followed through.
Monday and Tuesday, we will be taking a strike authorization vote. It's for the patients, yeah. I mean, nurses go into this field because we want to heal people and help people. Like, we care. We're like some of the most empathetic people I know, and I am so proud to work with the people that I work with. But the state of nursing as a whole is very concerning to me.
Along with the nurses, the hospital technicians are also struggling to find common ground with UPHS leaders. The contracts for both employees, although separate, they both expire in early September. In a statement, UPHS leaders telling us tonight that they are continuing to negotiate in good faith for new collective bargaining agreements and support their commitment to quality patient care for the community, and that they remain focused on reaching new agreements prior to each contract's expiration. Now, Hansen did tell me tonight that they are prepared to stay at the table for as long as it takes to come to an agreement. She did want to emphasize that the strike authorization vote, which is scheduled possibly for Monday or Tuesday, this vote doesn't necessarily mean that the nurses would strike, but it does officially empower their union to pursue that as an option. I also sat down with the masked technicians ahead of their contract negotiation. If an agreement is reached tomorrow, we'll have full coverage on our website throughout the weekend and an overview of the technicians' negotiations this coming Monday. You can stay up to date with the latest on negotiations by downloading the MyUPNow mobile app and get notified with breaking news and any updates. Check it out on Google Play or the Apple App Store.